Hey guys, how you doing? This is Dr. Mike of iCAN Clinic. Hey, today I want to talk to you a little bit about what things we can help with in kids, okay? And a lot of people look at the chiropractor as neck pain, lower back pain, headaches, different things like that. And that is correct. We are amazing at treating those things. We are the best in the business at treating those things. But the other thing is there's a lot of things in peer-reviewed medical research journals that validate chiropractic care for other things, that chiropractic care along with posture correction rehab exercises can actually help correct different things that maybe you would not think of, okay? So one thing, especially in the kids, is we're seeing a lot of more ADD, ADHD, and different things like that. Now, there was a study done back in 1992 that evaluated 1,000 babies after they were born, okay? And in those 1,000 babies, 999 of those 1,000 actually showed that they had some kind of dysfunction, fibrous tissue, or subluxation is what we like to call it, of the upper cervical spine, right? Now, how in the world does that happen? Well, I mean, you got to think about, you're trying to pull a baby out of a 10 centimeter hole, right? But that's a process that has to happen. It's by divine design, okay? The vaginal canal has to squeeze the head and let it loose, squeeze it, let it loose. And that kind of primes actually the CSF and different things in the brain and gets the baby ready to be exposed to the world. Now, in terms of a C-section, they cut a hole about that big, and then they come in and they try to pull the baby out through it. So they grab by the base of the skull, they twist, flex, extend, rotate, pull, go the other way, pull, different things like that. That's neck trauma, okay? And that neck trauma causes dysfunctions of that upper cervical spine. With the upper cervical spine dysfunctions, a lot of times these babies start to grow with a decreased curvature of the cervical spine. We are seeing kids coming into our office, 10, 11, 12 years old, lost a curve completely, or sometimes even a reversal of the curve. So you add the birth trauma along with the fact of like the technology age, down here texting all the time, on their iPads, different things like that, they are killing their cervical spine, okay? And you got to get that issue addressed. So in the Journal of Autism, behavior disorders and behavior were actually improved with ergonomic exercises and chiropractic treatments. That's it, right? So doing the chiropractic treatment and doing the adjustment into the cervical spine and then doing posture correction exercises was actually helping these children with behavioral disorders. They were showing a drastic change in these behavioral disorders, okay? The Journal of Back and Musculoskeletal Rehab actually showed that heavy backpacks actually decreases mental awareness, mental clarity, because it increases lower back pain. Now think about that. Think about in terms of your life, right? So you're sitting there at work, you got low back pain that's driving you nuts, it's killing you. Sometimes you got to take a day or two off of work and different things like that because you can't function properly because that back pain is just killing you. Think about these kids sitting in school. So they have the birth trauma that's happening. Now they're carrying these heavy backpacks and they're going around and they're getting lower back pain. It's hard for them to sit still in the chair, so they're squirming a lot. It's hard for them to pay attention because their mental clarity is shot from the low back pain and also the cervical spine stress. And what do you have? You end up getting an ADD diagnosis, an ADHD diagnosis. That's not going to fix the problem. No drug is going to fix that problem. These children need to get adjusted. They need to get treated. They need to get chiropractic treatment. They need to get their posture corrected. They need to get the curves in the spine back. Okay? They need to get their shoulders back, and they need to get the low back pain resolved. And this is all in peer-reviewed medical research literature that shows that chiropractic treatment is very effective. We are the best at getting bones to move and joints to move the way they're supposed to. We're also the best at getting posture back and correcting posture. So if you know of a child suffering from these, or you know of even your own child that's suffering from them, or if you're a patient of ours and you believe that this may be an issue of your child, feel free to bring them in or call our office, 618-254-CARE, and get them an appointment scheduled so we can check it, get it corrected if it is a problem, and get the child set for a life of health and vitality, not sickness and drugs. Thank you, and have an awesome day.